Botox is a neuromuscular blocker. We inject it into muscle groups to relax the muscle so that over the course of time you see fewer wrinkles develop in the face in those zones that are treated. Botox comes to us sterilized, prepackaged, but it is not hydrated, so prior to an injection we do hydrate the vial by injecting normal saline into the vial of Botox. This is then mixed, followed by drawing it up in a needle, which we will then use to inject our patients. Botox is not something that you schedule before you come unless you have previously received Botox. It does require consultation so that we look at your face and make sure that you're a candidate for the injections themselves. We typically like to have our patients avoid anything that might thin their blood for a couple of weeks in advance of the injection. So most of the over-the-counter pain medicines like Motrin and Aleve can have an impact on platelet function. We'd like for you to hold those for about a week in advance of the injection. Any herbals or vitamins that you may take, particularly vitamin E, fish oil, can have a bit of a blood thinning effect. And so to minimize the bruising during the course of an injection, which is probably the most common side effect that we see with an in-office injection, we would have you hold those before an injection. Before we inject, we sit you up, look at the wrinkle lines, and then we will prep your face, usually with alcohol, sometimes with betadine, depending on allergies. And then the injections go pretty quickly into the muscle groups. We know the anatomy of the face, what muscles we will have to treat to reduce what wrinkles. There is a little bite with the injection. It goes quickly though, and we usually use a little cool pack to offset the discomfort in the injection cycle. The most common other side effect from Botox injection is going to be headaches. And it's okay to take Motrin or Aleve after the injection cycle if you should need it for a headache that evening. We usually ask our patients to avoid overheating for 24 hours after surgery, but we don't want you to go from an injection with us in the office to the gym and work out. I think the hyperperfusion of the face can cause the effect of the Botox to be diminished somewhat. So for about 12 hours after the injection, we'd like for you to take it a bit easy. Botox usually takes 3 to 4 days to begin to set up. You will notice that your forehead or crow's feet, the areas that have been injected after 4 days, have less movement. It doesn't mean that all the wrinkles will be gone at 4 days. In fact, it usually takes 7 to 10 days for the wrinkles to have maximum reduction from the treatment cycle. If the wrinkle has been driven into your face over the course of 45 or 50 years, you may find that the wrinkle is diminished and not totally corrected. We can, if the Botox doesn't totally correct the wrinkle, then see you back in a week's time and do a little filler beneath the wrinkles as well. Typically then, 3 to 4 months after the injection cycle, you will see a bit of motor activity returning to the areas that have been treated. Following that, you may want to seek another consultation for further treatments. I'm Dr. Daniel Richardson. Thanks for watching our video today, and we look forward to having you as a patient.